afternoon. Welcome once again. This session is dedicated to the analysis of the institutional framework of the population profile. For me, as I mentioned this morning, I do not know what I have to do with this, but this institutional framework is close to my background. And I would like to understand the components of this framework. Definitely we're going to listen in details from our esteemed guests. We have Dr. Magued Osman, Dr. Maisa Shawi, Dr. Maha Robot, and I'm going to introduce them each at a time. But just to give you a brief intro about the panelists. The institutional framework, I started to look at it from the Ministry of Health. And each ministry is a mandate, and as such, the family planning falls under the mandate of the Ministry of Health. But the National Council for Population is another tool that falls under the Ministry of State for Population.
It's not one ministry, but from the legal point of view, because the presidential decree to set the tasks for the Ministry of Population. Maybe I started in the morning session talking about the vision, and maybe some of the points that pass through my mind from among the objectives and the targets that there are, how to solve the problem of population. I'm talking now about just ideas that were discussed in previous sessions or previous conferences. From among the tools is to raise the marriage age, and by this way I'm going to try to solve the population problem, to focus on the incentives, either negative or positive, but there are other tools that the whole world are using and are very useful to focus on women's education, media. Actually, talking about media, we need to go through lots of details, but there are two other institutions that we did not talk about them. First of all, the role of the local management, the civil society, actually is not clear to me. Maybe there are some issues and some talk about how to deal with the social civil society and how to deal with the problems, how to solve the problems. All these ideas should be under the legislation framework. If we are talking about the law must be enforced and must be one of the tools to achieve the objectives and to help me to find the mechanism that I'm going to work with. Otherwise, it will be a useless law. So what is the legislation framework? Do we have enough legislation to achieve our objectives or not? This is just a quick introduction. Maybe I have a problem with the National Council for Population. So whenever I look at his job description, I'm not going to talk about it all, but the job description that I have in the degree of its establishment It's between studies, recommendations, researches, statistics. I can't see where are the tools of enforcement. How can we achieve the objectives? I don't know how they are going to implement this in reality. Who is responsible for adopting these recommendations, and how I'm going to submit these recommendations to the other ministries, so each ministry will adopt its own role. Maybe this is with the council itself. My only comment on the council, I see that there are lots of ministries, and I can see representatives of each ministry, but I don't know what is the specific role of each ministry. I'm not objecting here, but actually I should have something to say that, for example, if these are the representative of the Ministry of Education, so the role are 1, 2, 3, and 4, and so on. I'm going to stop here. And I would like to thank you for listening, and I will give the floor to Dr. Magued Osman. Dr. Magued is a very famous and well-known person. He is the president of Baseera, and he is the CEO of the Egyptian Company for Communication. And he was the president of the think tank under the supervision of the cabinet. Please, the floor is yours. Actually, when I was asked to do a presentation about this subject in the conference, first of all, what came to my mind is that this center is concerned with economic studies, and there is an elite of businessmen in Egypt that they are represented in the center, and I also expected that people who are busy with the population problem will be here. So people who are busy with the population problem, for sure, they heard me million of times repeating the same points. So what's new? Actually, concerning these chronic problems, we are as if talking to ourselves again and again. And for sure, you know what I'm going to talk about. First of all, I will try to say something new, something different. Actually, I did not succeed that much, but at least for the audience that is not specialized in the problem of the population. For the others, unfortunately, I'm going to be repetitive for them, wishing and hoping that whatever we are talking about is going to be real in the near future. I'm going to start, first of all, to put a terminology, the PPP. So if you know the PPP, the terminology of PPP, any of the businessmen or the economic experts, it's public-private partnership or purchasing parity. It's progress, position, and potential. Now, while we are presenting, just bear in mind the statistics and the numbers that were mentioned before. Where are we concerning the progress, concerning the position and the potential of Egypt that will make us capable of achieving our objectives and reaching our targets. First slide in front of you is the number of the Egyptian population and its development, and how many years it took us to increase to 20 million. In the year 1950, we were around 20 million. Then in the year 1978, we were 40. In the year 1997, 60 million. 2011, we were 80 million. 2020, we are going to be 100 million. So 14 years or 9 years to increase about 20 million. So it is a high productivity. So, are we going to increase? what is the number that we are going to reach and how we are going to deal with such a big number. Why I'm focusing on this slide, and I know most of you, you know this information, because some of the people, they say, do we have a problem? We have China, it's like a milliard, so we don't have any problems and we can be like China. So let's talk about the changement that happened in Egypt in the last 10 years. This is the population pyramid starting from the year 2006 till 2016. You've seen since the mooning population pyramids for Egypt and for other countries. Let's see what happened in 10 years from 2006 till 2017. You can see that the base in the year 2017, the base of the pyramid increased. We all love the pyramids because we are Egyptian, so we don't want a different shape of the pyramid, so we are keeping the shape of the base of the pyramid. That's the percentage of the population under the year of 10. 2006 was 20%. In the year 2017 it was 25%. So we are talking about the children under the age of 10. They increased very much, and for sure they need at least schools. So now we are talking about the national project for the education reform. By coincidence that the majority of the children, they join schools. So the majority of the birth in the year 2012 and 2011. These are the children that they join schools in the year 2017, 2018. So the Ministry of Education, in addition to its responsibilities, they have a problem which is providing schools and classrooms for these children. What happened in Egypt? What happened in Egypt is we had stability concerning the numbers from the year from 1990 till 2016, from 2006 till 2016, the rate was 40%, and that's more than the booming that happened after the First and the Second World War. So we are talking about a phenomenon. We are not talking about 2 or 3 children, so we are complaining. We are talking about a phenomenon that is increasing dangerously. This 40%, we increased this 40% in 6 years. So for sure the classroom should increase by 60% in order to maintain the capacity. For sure this did not happen because it needs in the elementary school 900,000 new classrooms, and this need like 25 million pounds as investments. The number of births in Egypt in the year 1950 was equal to the number of births in Italy. In 1977, Italy and France. 2000, Italy plus France plus Spain. 2012, Italy, France, Spain, United Kingdom. Then 2014, the number of births, the Egyptian births, Italy, France, Spain, United Kingdom, Sweden, and so on and so on. So, you know, in the year 2017, as we said, 2027, we are going to add another 4 European countries. So the number of population in the year 2027 will be equal to the number of population in these European countries. So you can imagine the responsibilities for health, education, and for job opportunities later on. So we're talking about the population problem is fair enough. We are talking about reality. So someone can say, oh, these are European countries and they are different than Egypt. So what happened in the world around us? The total fertility rate that we talked about this morning, which is almost, we can consider it the number of the children in each family. This is the Egyptian curve and the Iranian curve. At the beginning of the 80s, Iran was higher than Egypt. They were 6.5 and Egypt was 5.5%. Through the 50 previous years, the relation was changed. The total fertility in Egypt was double the total fertility in Iran. So is Iran the only exception? In front of you, 6 countries: Algeria, Morocco, Tunisia, Iran, Bangladesh, and Egypt. At the beginning of the 60s, before the war of 67, before 67, in the early 60s, in these 6 countries, Egypt was the lowest one. Egypt, the percentage or the rate was 6.65. In the year 2010, gradually Egypt became the highest country, and these countries are similar to us concerning the rate of development and the norms and the culture. So there are people that they did things that we didn't know. Maybe the Iranian model is a different model, maybe the Chinese model is a different one, but there are other countries like Bangladesh, Tunisia, Morocco, Algeria. They did something, and actually they achieve progress. Each country, they took or adopt a specific route, and for this reason we have to find our own specific route. If we focused on the 3 countries in the region, the big countries, Egypt, Turkey and Iran, if we looked at the year 90, the 3 countries were almost the same. We were 56 million in each country in the year 1990. What happened after this? With the similarity between the Turkish and the Iranian model, they are going to reach the same number, the number of population. We are going to be 151 million by the year 2050. By the year 2030, the other 2 countries will be less than 90 million. We are going to be here in Egypt more than 120 million. So there is a big problem, even regionally. We have a big problem. Maybe some people will think that this is a strong point, maybe it's a big market and it's going to have a positive economic impact, but this market consists of the other markets. They have people with high education, high wages, high salary, high income, high health service, totally different than our communities. If we looked at the institutional framework, and I would like to thank the center for doing such a work, so I'm going to talk briefly concerning the different councils. Some of the council were under the supervision of the president, some of them were under the supervision of the first lady, some of the councils were under the supervision of the prime minister. So we tried many models. Also the members of the councils and the shape or the model of the council, some of them were, the number of the members were like 50 members, very close to the number of the cabinet, and we can expect with no effort that this council for sure will do nothing, because the big councils, that they actually lose lots of time, and they find it very difficult to set a time for a meeting. In the period in the year 2007 till 2011, there were some councils managed and by some ministers. We found other councils under the supervision of first under secretary and second under secretary. We have, for example, the Ministry of Health, and sometimes it becomes the Ministry of Health and Population. So what we did, we established the Ministry of Population 3 times in the year 1994, in 2006, 2007, and in the year 1995. I think the latest ministry, the lifetime, it was like 6 months. So can we imagine all these models that we tried? Did we do any evaluation in order to see how effective they were? So within 50 years, we can say which model is better than the other. Unfortunately, nothing was done and nothing was conducted. The idea of the ministries that as a reaction of a certain event, for sure, it will have no effect at all. And it will cost a lot. I think and I imagine a different solution. Don't look at the population, but let's look at the sustainable development. And I think, in my own point of view, that the big challenge that is facing Egypt is the multidiscipline, that we need more than one ministry to be involved in order to solve the problem. For example, in the morning, we were talking about the achievement that was done by Egypt, in certain subjects like bilharzia, for example, in addition to overcoming the digestive system diseases for the children. For sure, this helped in decreasing the death rate. But can you imagine all these achievements happened in one ministry? So in order to have this in multi-ministries, this is a big problem. So is the problem of population is the only multi-problem? No. We have other problems. Employment. We are talking here about the Ministry of Labor, the private sector, the higher education, the Ministry of Higher Education, the Ministry of Education. I put in front of myself here 5 files. The files, to succeed in these files, it needs a high level of cooperation and coordination between many ministers, and to have a kind of cooperation and a kind of effective steps done by the High Council that is supervising these files, to be responsible for certain numbers of files, to have a high authority, higher than the minister, to supervise, to monitor, and to evaluate. So from studying the different models, we have to find the proper one. So we don't talk about the population. We are not talking about the family planning like the title of the conference. No, this is part of the problem. I'm talking about the population problem as a whole, but it goes together and it's linked with the training, with the social justice, with employment. These are different files that we need a different action dealing with these files. But I have to put in my mind that the institutional framework a very important condition, but it is not enough. There are other conditions that should be fulfilled in order to succeed. So I think that we have 6 parts of the puzzle that should be related, that should be linked together. In the middle, I have successful institutional arrangement. And at the same time, I should have proper fund and financial support. Without these 3 elements, any successful institutional preparation will not happen. Then on the other side, I need to have evaluation, following up, and accountability. And as we said in the morning, the health questionnaire and the health survey that was conducted periodically, although it is funded by foreign fund, but there are internal regulations. It might have an umbrella that saying, for example, it's better not to know, it's better not to have this kind of information and database. So if we are going to manage such a complicated file without database, without information, so good luck. So if we looked at the last line, the cooperation between the different departments, academic people, professors, specialists, NGOs, private sector, for sure we are not going to imagine that the population problem will be only, the solution will be only in the family planning sector in the Ministry of Health. Also, we should have a political will, for sure. Mr. President, he talked about the population problem many, many times in different ways, in different events. And when he met a lady, he will ask her, how many children do you have? But did happen any trickling down for the political will on the lower level? Are the governors are talking about the same subject? Are the ministers talking about the same issue? I don't think that this is happening. Or at least it's not happening in a sustainable way. The problem is in the word of population seasonally. Every season we talk about the population problem, and then we calm down, and then pop up again, and then calm down. This is a problem. This is a continuous problem. The most important thing, I will call it the unknown soldier, which is following up, evaluation, and accountability. The population problem should be part of an accountability map. The ministers and the ministers if there is a kind of evaluation or following up saying, for example, this model did not succeed, so we need to choose another model. So choosing a prime minister to maintain or to keep the Ministry of Health and Population or not. This institutional frame, whatever it will be, actually this is not happening. Accountability is not achieved, and without information, without a database on the we will not be able to do this. So the package, all the elements of this package should be available. Then an overarching is to change the birth norms and the birth culture, and we required a campaign totally different than what was going on in the past. For example, if we conduct a campaign like Mohammadin wa Hassanin, it was a campaign talking about birth control. Even the movies, the series, people are not watching it on television. They are watching this on the YouTube. And it's now available for everyone. So for this reason, we have to think about new ideas, new tools, empowerment of the women. Why? Because there is a kind of competition between the role of the women as a production element or as just an element giving birth. Women, for sure, women that they don't work, the alternative is to stay at home and start giving birth 1, 2, and sometimes 3 children. Then talking about the religious speech, saying that we have to focus on this point. I'm not going to repeat myself again. I talked about this in the morning. We should have a kind of relation or a kind of link between the policies of the different ministers. We need to have a kind of networking between the ministers, and it might be very useful in dealing and in addressing the population problem. The priorities, according to my own point of view, first of all, to set an effective institutional framework, and actually this is not enough. We should have an information and a database, and to have a data bank, and to have and to conduct a population survey. So we can use the ID, the national ID. I can use it as a database, as a database bank, at least to know the number of children in each family. I think it will be very easy, and it can be very, very easy for the decision maker. And this is, again, to have a comprehensive social policies. In addition to finding the proper fund, from my own point of view, these are the priorities that we should focus on. I tried to present a brief presentation, because I have with me, I have professors, and I think their comment will be very, very useful. Thank you very much for listening. Thank you very much, Dr. Magued.